Hello, my name is Aiysha Saleemi. I'm a Pharmacist Advisor working at UCLPartners. This video is about two core elements contained in the UCLPartners proactive care frameworks for patients who are in most urgent need of treatment optimization. Firstly, the risk stratification for all clinicians to safely prioritize care. And secondly, the use of the wider workforce to deliver proactive care to all patients with long-term conditions by supporting patient education, self-management, and lifestyle modification. So in this video, I'm going to go over the meaning of risk stratification, the criteria that's been used to risk stratify patients in the UCLPartners proactive care frameworks, what the priority groups mean, and the role of the primary care team, including the wider workforce like healthcare assistants, link workers, and health and wellbeing coaches. So the definition of stratify is to arrange the different parts of something in separate layers or groups. So therefore, risk stratification is to arrange in groups according to risk. And the risk here relates to the risk of harm from a specific condition. So for example, a diagnosis of high blood pressure, also known as hypertension, can cause strokes, heart attacks, or dementia. So if someone's blood pressure is consistently raised, increases the risk of these events. So risk stratification arranges people into those most at risk of these events and therefore requiring consultation sooner, and those that are less at risk and so can be seen later. So how to risk stratify? We utilize national guidelines and expert clinical opinion to decide on the criteria that will determine those at higher risk and therefore requiring a review sooner. For each condition, UCLPartners stratification is informed by NICE guidance and clinical consensus. And the criteria for stratification includes age, ethnicity, clinical factors, comorbidity, and complications. The criteria is routinely updated according to changes in guidance and practice. The criteria used for the risk stratification searches can be found on the UCLPartners website, and the criteria used for all the frameworks has been developed and reviewed by senior clinicians, including GPs, pharmacists, and secondary care colleagues. Currently, we have searches available for 6 conditions. So that's high blood pressure, raised cholesterol, atrial fibrillation, diabetes, asthma, and COPD. This is an example of one of the criteria that we have used, and this is for high blood pressure. The searches are based on most recent recording of either home blood pressure monitoring or clinical measurements. So as you can see, priority 1 are the ones with the highest blood pressure measurements, and so it should be seen sooner. And in priority 2, we've used blood pressure as well as other criteria like ethnic background and comorbidities, and also looked at those people with no blood pressure reading in the last 18 months. This is the criteria for priority 3 and priority 4. And as mentioned, all this information is on the UCLPartners website. So in order to use the risk stratification searches, you go to the UCLPartners website and there's a short form to be completed. As soon as that's done, the searches will be sent to your email address. So we do have videos on the UCLPartners website for instructions on how to import and run the searches on EMIS and System 1, GPIT systems. And there's also a video on creating a sub-search. These are some screenshots from the UCLPartners website on the different videos that we have to import and run the searches. So once the searches have been imported onto the GPIT system, so that would be either EMIS or System 1, the search is then easy to run, so you can just watch the video and follow those instructions. The searches can be run by any member of the primary care team, so that could even be non-clinical staff who have been trained on using the GPIT system. The patients identified as priority 1 can then be contacted and invited to book an appointment for a review first. Priority 1 and 2 should be seen earlier by the appropriate clinician, and this could be a GP, a nurse, or a clinical pharmacist. And then priority 3 and 4 can be seen later. In addition to the clinical appointment, all patients need support with education, self-management, and behavior change, and signposting to resources, which can be provided by staff such as healthcare assistants. Teams can decide whether they would like their healthcare assistants to contact the patients identified in the priority 1 group first or in other groups. I hope this video has been helpful. If you need any further information, please contact us on primarycare@uclpartners.com. Thank you.